Hello, everyone. I'm very glad to hear and see you all in these unsimple times. I hope you are well, and so are your loved ones. Right. About the situation in Israel regarding medical tourism. Just as you said, some of Israeli medical centers have stopped international collaboration entirely. I do point out that some, because some others didn't. With them, we collaborate quite extensively, like Hadassah Medical Center and a few others as well. In general, it's very dynamic. I can't really put a connection between the dots between change in the field of medical tourism in Israel and the COVID situation. However, I can point out profile changes in medical inquiries we received during 2020. I can point out that the medical inquiry profiles are more, so to say, difficult to treat or require at least a higher level of technology. I'm talking about cases like genetic orphan diseases, or cases like head tumors, like gliomas or astrocytomas, cases that require most advanced genetic panel testing and molecular mapping, like Foundation 1 or Cancer Hope. It doesn't really matter which ones, but the most advanced ones, as well as in some cases, bone marrow transplantations are required. In these times where logistic chains have been shut down almost entirely, I am glad to inform that we are able to assist and provide solutions to our patients that were already in Israel in treatment when the whole thing started with the COVID and the isolations, and new patients arriving at these times as well. Online services have, of course, been prioritized, but once again, I don't want to connect those dots with COVID. In general, we provided and kept on providing online solutions. Our affiliated medics do this, we provide, as well as the second opinion online medical solutions, as well as there were some cases in which we provided it was entirely reprofilation of the patient, because they had some sort of diagnostics already done in their source country, and unfortunately it's quite the script, you know, when the patients are getting re-diagnosed entirely, and we have to proceed with the medical picture from there. Changes in health tourism in Israel. Well, it changed drastically. I can't lie here, because at the moment the borders in Israel are closed to foreign visitors. And there is quite the arrangement to be done to receive entry. There is a certain medical commission that reviews every case, and then after reviewing and approving the case, it is approved by a certain board in our Ministry of Healthcare. It's quite a quick arrangement. It happens in about 48 hours, and after that the patient is granted entry. Not all patients are granted entry at this point. There is a classification of first priority patients, so-called. We are talking about oncology cases that cannot be delayed, bone marrow transplantations that cannot be delayed, and so on. But it really is from case to case decision. Conditions for foreign patients upon arriving to Israel. Well, as I said, there is a commission discussing every case separately, but afterwards, incoming patients from overseas are required 14 days of self-isolation. And if during those 14 days they feel a bit ill or their medical condition simply does not allow those 14 days of isolation, they simply go to the hospital COVID wards.
Okay, Jakob, so it seems to medical tourism, it's recovering faster than simple tourism in Israel, right?
Yes.
Yes, you are right, because, well, some things should be delayed perhaps in such times, and some things really cannot be delayed.
So patient can come to Israel. So for a lot of people, it's important information, and so
this
that's
week
great.
we have 2 arrives in Israel of oncology child.
Mm-hmm. Mm-hmm. Great. So, and I know for Karina, you sending some pharmacies to other countries from Israel. So it is possible. It's very important.
Possible for our patients which was in early treatment in Israel, or which one received our protocols by pandemic period, and we are with a very difficult way, but it's possible.